The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone. This is Sarathel Burgess Burnett, Deputy Commissioner here at Department of Family and Support Services, Children's Services Division. Here today to go over some really important information, and this is regarding communication planning regarding lead and water. I'm going to go over a few documents with you, a few key points, making sure that I'm giving you information, hopefully answer some of the questions that I'm sure all of you have. But again, what I want to thank you first before going into this is thanking all of you that have been working with our team that's out and about in the community and actually doing the water sampling. So with that, let's go ahead and get started. So one of the things I just want to say really quickly and remind everyone, all of this is about the health and safety of all our children and families, also you and your staff. What we are wanting to do is make sure that we do what's necessary as defined in licensing, which is sampling water in all of our sites, ensuring that we have no one there, no faucet, no fixture that has water that exceeds the level that is in the licensing standard that says no more than 2.0 parts per billion. It is also within the licensing standard where it also determines what facilities are required to be tested, and it is those facilities whose structural date is before January 1, 2000. So again, if your facility was built before January 1, 2000, you are required to do lead sampling or water sampling. And we have you on our list. Some of you I know have already taken care of it. You've already had your water tested. I want to thank you for that. For those of you that are working with us, again, this is a thank you, but also to go over some definite things that you need to have with you and at hand as you're working with your families going forward with your lead testing. So again, this is about communication planning. And so what we've assembled for you is a packet of resources for you to use to communicate with your parents first. What we put together is a letter, and the letter actually comes directly from me, and it goes over all of the information regarding lead testing. Again, the target date or the date that's in licensing, wherein all of this has to be done, which is May 1, 2019. And then it also provides you information about the 2.0 parts per billion, which is what I mentioned before. And it also makes sure that you understand that there's going to be documents that you will receive, templates for letters for parents and so forth. That's what this letter is, and this is a letter directly to you. Hopefully this letter and the words in it might answer some of the questions that you might have. The next document within your communication plan, again, is making sure that you're able to communicate with your parents, because your responsibility is to let them know that you are involved in getting your water sampled, making sure that they know what all of this means, making sure that they have something that they can look at. And this letter has been produced. It's a template. You can put it on your letterhead. You can then have your lead staff sign off on this. What we're doing, again, is just providing documents we hope that will help you in this process. And what you have here is a letter directly to your parents, letting them know that you're engaging in sampling or lead testing at your sites, making sure that they understand what's in the licensing standard. Again, that your facility is built before January 1, 2000, you were required to do this. Or if you were built after that, you don't have to. If they get information about testing and are wondering why you are not, this letter might help you with that as well. The next thing that we want to make sure you do, for example, once you are testing your water, once we come in, or if you are doing it on your own, if that's what's happened, if you have any faucet, any water source within your organization that tests above 2.0, you have to have a plan, a remediation plan. And so the next template that we're sending out to you today actually covers for you information that you need for that. And so in this letter, what it is a letter that you need to post. Licensing requires that you post, letting your parents know that you have had your water sample. You are required to let them know of any exceedance over 2.0 parts per billion, must be acknowledged. But you also have to have a plan. And if you see the highlighted portion on here, you're required to say what your test results were. And this is where you can actually include that information. These are templates. I'm not saying that you have to use these actual letters. What we're trying to do is ease your stress and provide you templates and documents that might help you in this process. So again, this is one that you would use after your water has been sampled, results come back, and you have an exceedance. And then you will be required to make sure that your parents are aware, and this again needs to be posted at your site. Licensing says that it must be in a visible spot so that they can see that. When you have parent meetings, it's an opportunity for you to go over it as well. And so when we're talking about remediation plans, what we're saying is that you have to provide alternative drinking water sources if you have an exceedance of 2.0. What we are finding is that you may have one faucet that needs to be pulled offline, meaning that you are not able to use that particular faucet in your facility because that one faucet exceeded 2.0 parts per billion, excuse me. And that is an acceptable remediation, meaning that you pull that out and no longer are using it. But temporarily, you need to figure out what are you going to do. Now, you do have some requirements that you have to fulfill. That is, if you have any place in your facility where you're over 2.0, within 120 days, you do have to send something to your licensing rep at DCFS. You are required to submit your remediation plan. You're required to let them know exactly which faucet, where, what happened, what was the exceedance, and then what is your plan. For example, if you found a faucet, it's only one faucet, you've got 15 faucets in your building, we test 15, one comes back over 2.0 parts per billion, you can pull that one faucet out. That can be your remediation plan. It may be more extensive than that. I can't speak to what all the different ways you might have to remediate, but I just want to make the point that you are required to have a remediation plan. You are, again, required to make sure within 120 days of getting your results that you have that plan put in place. We have our techs out there actually doing your testing or sampling. They can also work with you on creating your remediation plan and making sure that you know what the next steps are that you need to do. So we're walking this path with you hand in hand. And today we're just giving you resources, and I'm going over some of them to make sure you understand how to use those. And so within your communication plan, there's some information sheets that we also wanted to provide because there are some resources out there that can be helpful throughout this process. And so we're also going to upload these as well. And what we have done is we've done these in two versions. There's an English version and a Spanish version for you. So these will be available. You can download these. You can give them to your parents, have them available. Make sure all of your staff are aware of what's going on in your sites regarding testing, regarding the sampling, regarding your results. Everyone should be aware so that everybody's got the same communication, understanding exactly where you are. You go through this process, you have no exceedances, then you don't have to do a remediation plan. You can have one faucet out of all of your faucets in your building. You do have to do a remediation plan. And so what we're giving you, again, are these templates and then other resources you can use in this process. And so you're encouraged to stay in close communication with your families over the next few months about what's going on. They're going to hear about it. They'll be aware of all of this and may have questions. And so we're trying to lessen some of that on your behalf by giving you templates that you can use. We recommend that in your parent meetings that you go over this information. You have information out and available for parents, letting them know so that they're aware of what all of this is. And that, of course, you can always, and we encourage you to stay in contact with your lead here at Department of Family and Support Services. And that's your lead on your monitoring team, just in case you have questions. They're aware of all of this process as well and are willing to have conversations, answer questions. And if they can't answer, they know to direct those questions to either myself or to B. So again, I want to thank you for spending a few minutes listening to me talk about this very important topic, making sure that you have access to resources. Again, what we're trying to do is make this as easy on you as we possibly can by sending in the text to your site, now giving you resources to communicate. And if there's anything else that you think you need to assist you through this process, please don't hesitate to let us know. We want to make sure that you understand there's a couple of other things going on here at Department of Family and Support Services. One of the others that I want to draw your attention to as well is Dr. Bergeron, who is our Office of Head Start, the director, has really given a challenge, and there's a campaign out there wanting to enroll 10,000 homeless children by the end of 2019, March of 2019. And so what she's done is said to all of our grantees and everybody across the nation, we need to be looking at our services and how are we engaging families who are experiencing homelessness? Are we engaging them? Are we getting them enrolled? we know from some of our data that we currently have families that are enrolled in your programs across the city that are experiencing homelessness. But we also understand that there's a lot of other families with children that are out and about in our communities. And so we're encouraging you to figure out, if there's anything we can do to help you, but to think about different kinds of ways that you can actually go out and engage and get more families encouraged in coming in your door, letting them know that you have services that are available to them. We want to open up the door and make sure that there's access for Head Start services for our homeless families. And that's what we're encouraging you to do. This link that's here will take you directly to a website where she has done a discussion, Dr. Bergeron, regarding accessing homelessness. And we encourage you to click on this link and watch the video and learn a little bit more about what it is her charge is and what she's asking us to do. There's some ideas and some resources embedded within that website as well. One of the things we will do when we have our EDPD meeting on Thursday, we'll go over it again, but we just want to make sure that you have access to it now. Maybe you want to preview it before the meeting on Thursday, and that would be great. Just in case you preview it and have questions for Thursday, just bring those questions with you. Again, as a reminder, each time we do a webinar, we want to remind you the next time we're going to be engaging with you. And we do have our EDPD meeting this Thursday, March 8th. This Thursday, we will be at Truman College. We've been there before. We're back at Truman College one more time on the 7th, the 8th. That's me pushing the week, trying to get to Friday. And it actually is on Thursday, the 7th. And so we hope to see you on Thursday there at Truman, where we will be having our next EDPD meeting. So hoping all is well. Hope everybody has had a nice day today, been able to stay warm. We look forward to seeing you on Thursday. Again, if you have any questions, don't hesitate. I'm always available via email and be available as well if you have any questions regarding sampling of water and lead testing. So thanks again for taking some time to listen to this webinar, and we'll talk soon. Thanks, everyone.
We call so